All right, so welcome back, everyone, on Innovators of Health podcast here with my co-host, Dr. Rahul Desai. And today we have Dr. Shandra Rosenfeldt from Serenity Valley Family Dental in Fargo, North Dakota. Thank you for being here with us.
Yeah, thank you for having me.
So I'm just going to jump right in. You founded Serenity Valley Family Dentistry back in 2006. And from what my research, it says on the principle of comprehensive care with a gentle touch.
Yes.
And so tell us a little bit about what inspired your vision and, how you got started.
Yeah. Well, it just inspired my vision to have a very warm and caring place for patients to go for their dental care. I chose dentistry for several different reasons, but I enjoy that patient interaction, the relationship you kind of build with them. So I wanted something warm, caring, and you get to see families grow with time as they continue to come back. Um, and so really the comprehensive, what I thought it meant at the time was just looking at the whole picture and being proactive as far as remineralizing teeth versus doing fillings if you can. But it's exploded into a whole different realm of health and collaboration that I didn't even realize until, later down the road, probably about 2017 or 18 is when I realized there was a lot more to health and oral health and how it's connected with your full body health.
Can
Nice.
you talk a little bit more about maybe that, especially for the the novice, and where you started to see so you're talking about like cavities and fillings and like there's a different way than and we hear a lot about it, and I'm definitely uh not up to speed on all of the details, and I know there's controversy, but with is it mercury or other like the fillings? What are the things that there's concern about and toxicities, and then you hear about biologic dentistry, and then there's a kickback, pushback on that. So where are you in that thought process or spectrum?
Yeah, I am a following and understanding what's important to patients, but always giving them options. So I don't veer on either side severely of that spectrum. I like to see research and make sure it's backed up if there's something we're going to implement, and trying it first, a lot of times on myself, family members, friends. So I'm kind of in the middle of the spectrum in that realm because, yeah, there's a lot of controversy, and I think there's a lot of research sometimes that isn't. You got to read through it a little bit more to realize that what was summarized from that research wasn't validated. It was kind of taken out of context a bit. But I think dentistry does have a lot of great things, preventative, and our health is going to be symbolic, and sometimes things are seen in the mouth first. And honestly, what kind of transformed my idea of health and how dentistry is interrelated with other disciplines of health was how the tongue functions. And that was because of my first son. He was born in 2014. So that's where I realized dysfunction early on with feeding, sleeping has just a chain reaction of events that can happen. The first 1,000 days of life are really important for health and function. And so it opened up a lot more with sleep, TMD, tongue ties, lip ties, all of those things. And then starts going into like research and how photobiomodulation and light therapy is getting energy for healing where we need it. So it
Yeah,
changed from doing dentistry and working on teeth to looking at how it all works together.
very cool. So did you have to implement some of those modalities and some of the with your son? I mean, you can share what you feel comfortable with, but how did that change your perception of what's happening?
Yeah, for sure. It's been, I call it an iceberg. Like I thought I learned a little bit about tongue ties, and then it turns into, there's myofunctional therapy, and then there's fascial tension. And I don't know about your experiences, but when I went through dental school and we were doing anatomy and learning about the human body, fascia was just discarded. We didn't really talk a lot about it, right? And realizing now, like we have live video feeds of how the fascia is like interacting and connecting and communicating with the different parts of the body. Um, but I learned that more from seeing, like helping my sons, actually my daughter, so all three children, just they were at different ages when we realized how much this was part of it. But dealing with their dysfunction and how that has such a reverberating effect throughout the rest of the body. Patients that will tell me after their tongue was released, and they're also doing body work and they're also doing true function, right? We're getting the tension released, but you have to get the function back too. And how all of a sudden their headaches are going away, or they no longer have pain in their sacrum or their low back, and how quickly that can happen. Um, but there's still modalities where we're using that red light to get energy and healing where we need it, because this isn't like a one time and done. It's not one thing and you're healed. It's going to be a process. It's a pathway. But at least if you can start getting people feeling better, then they have more energy to continue on a prevention pathway and not waiting for things to get worse.
So,
Yeah,
Dr.
that's
Rosenfeld, you're clearly a innovator in this space, especially since you're using modalities like photobiomodulation. When did that first catch your attention? And just as a segue to, I see the Red Vive 300 behind you. You know, what caught your attention, and how have you been using it in your clinic?
Yeah. What caught my attention is maybe about a year and a half ago, and it was utilizing it more with a laser photobiomodulation as far as like releasing tension, getting healing, reducing inflammation, all of those things. But you were limited on patients having to come in and you're going through that process for them. And then through like a wonderful group of colleagues in a study club that we're a part of, learned about Red Vive and how this was exactly what we needed for red light therapy. That's all the things that you're going to look for, you had. And what a great way to have an option for patients to be continuing their health when they're at home. So you're getting that frequency. They're getting more than what I can ever offer a patient just when they come in. I only have so much time to help so many different patients, and you want to help more. So now they can have that in their home.
Any specific things that you can speak to that caught your attention? Because there are several other red light panels out on the market, and people are, constantly doing their research, going on Amazon and stuff. But, listening to you here, you learned about this amongst your peers, all, physicians, what about the Red Vive, and did you hear about that really said, this is for me, this is for my practice, and this I could see for my patients?
There was a lot of things. Well, honestly, it was the first thing that caught my attention was, the wavelengths that we need, that they were all there. I liked the portability of the smaller units. Like that would be easy to have for patients in the office or for patients to bring home and have by their bedside table. And then, honestly, it was a lot of the other, just the business aspects of Red Vive. There's good support. There's good support with when people buy the product. So all of those together, like you're getting the science and we're getting what we need, and we're getting kind of a durability, and then you've got a great company backed behind it.
That's fantastic. That's a good answer.
Yeah.
All of those things.
We like to hear that.
Yeah.
As you've been implementing this, I know that you're both at home with your family and then with your patients. Are there any stories that really stand out to you as far as, boy, this is really, making a difference, or I really like implementing it with this type of therapy? Or how's your experience been?
Yeah. I think the one thing that I've enjoyed, I don't know if I have any huge stories, but what I love is patients that are coming in and they're chronic pain, and there's a lot of things we can do to help them reduce that pain quickly. So let's say it's a TMJ patient. We can make different, whether it's a splint or something that they may need, and we can reduce that pain. Let's say it was like 50 or 80%, and that's great. But this is somebody that's been in pain for years. And so there's going to be a little like the icing on top. Like, what else can we do to help them? 80% is great, but I want more. I want patients to feel even better. And that's where them doing something more for themselves at home and having that red light and just getting, reducing that inflammation and getting more healing and less pain, and how quickly that can happen, I think has been just a really important thing for patients to see and feel, and to understand.
Are they getting that in the clinic as well? Have patients expressed that? And we saw that like the benefits were pretty quick. Have you noticed that in the like giving them a test dose, or how do you get them to experience it?
Yeah, I've used it more like in a room, like as we're working with them, and specifically TMJ patients. But I want to have, because we've brought up before, I want to have more of a place where, as maybe a parent is sitting and waiting for their kids for their dental appointment, that they could have some relaxing time and just get
Hmm.
this lovely, warm energy. But we have a lot of kids in our practice, so I've been a little concerned about having it up front. So I've been trying to think of a nook or a place where they could sit. Um, we do have we call it a mama's room. So it's where moms are waiting while their babies are being taken care of. So my thoughts are might be something where we can invite them like while their kids are getting taken care of, if you want to go relax and have some red light. So we've been trying to brainstorm like where in our office can we have more exposure for patients to just use and feel the
That's
benefits.
lovely. Yeah. It definitely like fits in with your ethos too. That's a nice, I come in and
Right.
have that relaxing, re-energizing medicine as you
Right.
wait.
Yeah. Yeah. Just feeling better, walking out feeling better, while your family's taken care of.
When you're
What are the
speaking with the patients, how do you introduce uh, photobiomodulation with your, all of the different things that you're offering? How do
Yep.
you position this for them to have them understand like how powerful it could be?
I I like to educate. I'm always curious of why things work, and so I like to give information and I like to give options. So I'll let them know, for example, for a TMJ patient, what I'm going to make you is going to help your jaw feel better, and it might be like crutches, but to truly get regenerative healing, there's more. There's more that you can do, and whether that's utilizing PRF. But if you're going to do PRF, then using the red light therapy before and after is going to be hugely beneficial to get the most out of each of your sessions. Um, and so I just kind of like to have options for patients and let them choose what fits, and just giving them that concise information of the why it's important and letting them choose from there.
Very cool.
I was curious about what other therapies um, does red vibe therapy complement? So when a patient comes in and you're assessing them, what are the various different treatments that you're offering where this becomes a
Fits in.
great modality as an adjunct to what you're offering?
Yes. So the first one I think of would be patients that are coming in with sleep apnea. So obviously we can make them an appliance, and that helps reduce maybe their obstructive sleep apneas. And there's a lot of patients that feel really great, more energized when they wake up, but there's still some patients that feel better, but maybe not as great as some other patients. And so again, integrating, getting that light therapy and them understanding how this is helping, with like the photoreceptors in the eyes, and just getting the brain reset a little bit more and just getting more restful sleep might be what they need. Um, and so it can be utilized for sleep. I use it much more for the TMD and pain patients. Again, because there's things we can do that help them feel better and feel better quickly, but maybe not 100%, because this has been something they were dealing with. I mean, sometimes it's 20, 30 years. It's like you're not going to make them crutches for their jaw and they're going to feel better 100%. So utilizing it for continued healing and energy to the cells that are our powerhouses, right, for healing and regenerating in our each of our cells of our body, so that we get true function back.
When you're doing
You ever have
the
patients that are
tethering, oh, sorry, Jay. When you're doing the tethering surgeries, it sounds
Yeah.
like both there are a lot of peds and there's some older patients as well. Are you
Yep.
seeing some? Is
Yep.
there, are you using that in or leveraging photobiomodulation in those settings too, or have you seen that as far as reduction in inflammation? I'm sure there's some post-surgical pain and then also the healing of the tissues. Is
Yeah.
that something that has been that
I
you've seen any cases or implementation?
Yeah, so I've used photobiomodulation, but I've used it more with the laser, I haven't been using the red light as much. So I'm definitely open to learning a little bit more like how that could, additionally help patients. But I'll use it after surgeries. Sometimes before surgeries, there can be patients that there's enough tension throughout their whole fascia system, not just the frenum and the tongue tie portion, that you kind of want that to start to separate and move a little more freely. So you're doing a more precise surgery and actually releasing what needs to be. So using it, photobiomodulation before has been extremely beneficial. And then a little bit after as they come back, because I usually see them at least a week, and then there might be another one where it's a couple weeks later. Um, so I'll use the photobiomodulation that way. But I haven't used the red vibe in that aspect. So that would be interesting to learn a little bit more of like where that would help patients more.
Yeah, I think it could help them to like some of the like oral mucositis is the for pediatrics, especially for patients that have oral ulcerations. They have kind of superficial applications or extra oral application of the photobiomodulation, and now that's a standard of care for healing. So there's enough power generated from the units to get into the oral mucosa, and it
Yeah.
stimulates accelerated healing, reduction in pain and inflammation. So it's a kind of an adjunct to that, and even preconditioning if somebody comes in, they've seen it with that. And one of the other things that you spoke of that was kind of interesting was either the myofascial components, and we've seen tremendous improvements in the fascial treatments. And one of the things that I learned this in the last year was the lumbar fascia. The thoracolumbar fascia is full of capsaicin and TRPV1 receptors, nerve receptors in the fascia, and that's a really big source of low back pain and dysfunction and neural inflammation. And then if that continues, then it starts to have downstream issues on the actual, bony and soft tissue structures, and those are really susceptible in a good way to photobiomodulation therapy because it's relatively superficial, the fascia. So even around the head and neck, that treating those areas, you get almost immediate analgesic benefit. And then if you continue to dose that, the inflammation comes down and there's neural healing, regenerative healing that occurs with that kind of continuous dosing. So it could be a really interesting like application of this. And we're learning more and more applications as we're using this and as the science is becoming better elucidated.
Yeah,
So
I
for
think
a
so.
patient who's listening to this, how do you define analgesic? There's some medical terminology here. I want to make sure that when Dr. Rosenfeld's patients are listening to this, they know like, oh, what does that mean to me? So what does that mean?
So
What do you just
analgesia,
ask?
right?
Yeah,
Yeah.
yeah.
Analgesia just means pain relief.
Okay.
And so, yeah, when in that pain, and where's that pain coming from? Is it inflammation? So then that's a great
Mm,
way for photobiomodulation, red light. Is it damage? So then we want to get energy where it needs to go so we can heal and regenerate. But yeah, it's
sure.
getting pain relief.
And are people feeling that? Like usually when you introduce, red vibe to them and they start to feel it, what's usually the sentiment and in terms of how long does it take for them to start feeling relief? Is it immediate? Is it a few minutes? Like what's been your experience?
Our experience has been there is immediate relief. So there's immediate reduction. And then as you continue to use it, you're just going to get more and more relief. And I think there's been a lot of patients that maybe before they'll get temporary relief and then something will cause it to come back. Maybe they were then working out really hard or something happened where it changed. And so that pain starts to come back. And then this just helps keep that away longer, keep it from flaring up like it was. Um, so I think that's where this really shines in that you have it at home to do that whenever you need to. You can do the best and try to do things daily, but life throws things your way and you have to be ready to kind of be resilient again. We talk about that a lot. Like having true function means you're resilient and you can work through when something happens. And that's where the photobiomodulation of red light can really help.
Very
I
cool.
love,
How
well, I
do
was
you
going
see
to say,
this? Oh, go ahead.
oh, sorry. I was going to say when you brought up the lumbar, there's so many patients, like older patients that that have been dealing with dysfunction and maybe a tongue tie, and a lot of them have so much low back pain, kind of the upper traps and low back pain. And a lot of that goes away quickly in the upper head and neck with the release. But a lot of times I've noticed with that fascia, talk about like it's like a living web. So even though you release tension in one area, it's going to connect, throughout, and a lot of times it's going to land in that lumbar area. So you sharing that reminds me, I'm like, well, that's a great way to really have one more option for adult patients that are going through this, and them realizing, there's going to be some changes and your body's going to feel different. And here's something you can do at home to make that process easier and faster.
Yeah. Have you been using, one thing that we've noticed too with a lot of our practice and the practitioners is that, leveraging this even outside of kind of the issue that, patients are showing up for. That if
Hmm.
they're coming in for a specific problem and they go home with, a device like, a photobiomodulation device that's so powerful in so many different ways. Have you heard any stories or seen anything at home or, 'cause that's our mantra is that you're never going to put this device away. Like we have one at home and everybody uses it uh, literally every day. Somebody's using that device for an ache or pain or for, post-workout recovery or those types of things. Have you noticed that as far as when you're talking to patients about that you're going to get the resolution of your TMJ where you're here to fix that, but don't put the device away. It's not like a crutch or something that you're going to, get rid of or put in the closet.
Right. Yeah, I think a lot of patients get, especially after using it daily, that they just feel that different energy, just feel better. And so they're going to continue to use it. And then what I love is then seeing, like in our office, it's team members, there's downtime, and I see them over here using the red light, or family members are wanting to use our red light, or then patients talking about how much they use it. And now I need to get this for my daughter, or my daughter needs to use this, or my mother needs to use this. Just seeing them then realize where else this could be applied and who else may benefit from, kind of healing, and that positive energy for healing and feeling better too.
What are the things that you hear being said in terms of their experience?
Um, their experience is just like it feels warm, comfortable, it's easy. A lot of them like to, a few of them have the larger panel, and how that can be easy just to set next to the chair. Oftentimes we'll talk about it may not work as well to try to get next to the bedside, but it works well to sit like in a recliner and use that. Um, a lot using it for like post workout. When you've kind of worked out, did a hard workout, doing a lot of, maybe it's strength exercises to just help feel better faster. Trying to think of what else. I think that's the most of what I hear.
Yeah.
Very cool. Well, how do you see it changing because you've been using it for how long? Has Red Vibe integrated into the practice?
So Red Vibe, it's been, I think it was early this year, so maybe it's been about 6 months.
6 months. How do you see that over the next few years? Do you feel like it'll be, continuing part of your practice and a growing part of your practice, or how's your experience been, and what's your thought in the next few years? What that
Yeah,
looks
I
like?
think it's definitely a growing part of the practice, and it's something as I continue to learn more about it too, and more applications and more uses, that it'll just become more and more part of the standard treatment care, right? And how to make that easy for patients, and how is this part of their healing and their care here, but then they can continue that at home.
Yeah.
And for practitioners who are listening to this, for those who haven't embraced photobiomodulation the way you have, what would you say to them? What would you say to them about red light therapy and Red Vive?
If you haven't embraced it, I think you can find research lots of places. So if that's something like I always kind of go to, I want to read some research on it, and how it's getting energy. That's good part of the sun. We're getting energy to our cells, to our mitochondria, and that's what we need. That's the powerhouses. So that's going to help you feel better. It's going to help you heal. But just look into it. There's lots of different ways that you can implement this, and a lot of us are going to start with us first. Like, you start using it first, you start to feel it, have your family start to use it, and then you get to feel it. Then you feel more confident to start talking with patients about it and how it feels, what they notice, what they will notice.
If there was one pain point that you could solve with this, that
Mhm.
people mostly come to you for, what would it be? So, and I'm thinking about it from the perspective of you're going to have patients listening to this. And when they hear you speak about this and you're educating them on this, and because it's never really come up, you're an innovator here. What would they maybe be feeling? Where would there be pain? What should they be looking forward to
Yeah.
when they come to see you? And what to even ask you about this?
Yeah. Um, Gosh, so a pain point could be, yeah, maybe it's where you're having difficulty eating and chewing and you're having pain, or you've noticed your jaw always made noises. Maybe it used to click and pop, and now it's changed to more like a crunchy sound. Well, we know that's not a good thing. That actually means the jaw joint is breaking down further, but that doesn't mean surgery anymore. This doesn't
Mm.
mean you are going to have to do surgery. So we don't want you scared of that. There's a lot of options to really get regeneration. Um, and I think as this is incorporated more and more to like traditional health and what we need to be doing, um, I think in 10, 20 years, we'll look back and just think how maybe sometimes barbaric we used to do, large surgeries, and we start losing that blood supply and not getting the results we thought we were going to get.
Mhm.
That really incorporating light energy eh, is in a different way that we're going to get healing or letting the body heal the way that's kind of what medicine is really. We're helping support the body, but the body's doing the healing. We just need to get it what it needs to heal.
Mm.
Um, I mean, that would be one example because a lot of patients, when they start having jaw pain, that's what their brain goes to. They go to the worst case scenario. They're like, "Oh my gosh, I don't want surgery. I haven't heard great things, and nobody really wants surgery." And it's for them to realize there's so many options now that we can get you feeling better and get you pain relief and functioning better um, with easy modalities.
That's awesome.
Amazing. Well, thank you so much for your time today. And any last words or ways that, I know we're obviously gonna to put this out there, and folks in your area and would love to come see you and get these benefits. How can they get a hold of you, or where should they go?
Yeah, so they can reach out multiple different ways. They call a phone number. We have two different websites. So I do have two different practices. I have the general dentistry side, which is the Serenity Valley Family Dentistry. But then because there was such a need and it was easier to focus on another part of the practice while, we still have the dentistry practice going too and help that way with other dentists is the Serenity Sleep and TMJ. So either website, it's really the same number, but you're going to get a different kind of process and different options depending on what you need. So through the website, you can also email. All of that is on our website. And we'd love to just find out more like what patients are looking for, and we will give them information and options of how we can help them.
Beautiful. And hopefully we can post that up, Jay, uh,
Yeah,
on the
absolutely. No, we'll have it in the show notes, and we'll have it um, there for people to know about you. But you know, if there's if you could think about one last thing,
Yeah.
how would you like people to think about you and your practice? When they hear about you.
Um, I guess maybe one thing is, I love that this is called Innovators of Health, but to me, it kind of made me feel like, what if I'm not an innovator? What if this isn't where I'm supposed to be? What if this is, just a facade? But then when I had to look up like an innovator, because I'm like, what am I doing that's different? Um, I just kind of read that, well, innovator is somebody kind of putting curiosity into action. Then I felt better. I'm like, oh, I am totally curious. I always want to know more. I always want to know why. I may not always be able to solve every single patient's like all their symptoms, 100% of them, but I will always get them connected with, maybe another healthcare provider. That collaboration is really a lot of times what we need. I can help with this part, but let's get you to somebody else that's going to help alleviate more of those. So when you're calling our office, whether it's on the dental side or the sleep side, I will do everything I can to help. I'm going to look for answers, but I'm also going to get you connected with people that know more, so that they are getting kind of a full healthcare with collaboration with many other professionals that are doing the same thing, looking to learn more from each other and help patients thoroughly.
Well, that's
Yeah,
beautiful.
I can
Thank
tell
you
you
so much.
this, Dr. Rosenfeld, what you're doing is truly innovative, and you're bringing with both the PRF, I think your novel surgeries, the minimally invasive, the photobiomodulation, you're absolutely bringing patients options that they normally don't have. And I do think that we felt the same thing, when in our practice doing stem cells and regenerative medicine, seeing all those successes over the years, you get used to it and you think that's the standard of care.
Yes.
And you think that everybody gets access and information to this, and they don't. Like, there are so many folks that are suffering from issues, and they go through the standard of care and they don't get better.
Mhm.
And they get passed around, they get cortisone injections, they get unnecessary surgeries. They get dismissed as, well, that's nothing. It's just you're getting older, whatever. And like, so just again, we applaud you. Don't take that for granted. We and I know your community around you appreciate that, and you are a true innovator of health. So thank you for
Yeah.
sharing your story.
Well, yeah, thank you for also being an innovator and really doing this. But that's what I thought of. I'm like, well, I haven't made anything. 'Cause that's what I thought the innovator was. But yeah, it's easy to forget how that, what you're doing isn't just the standard. You just assume that everybody is doing the same thing and searching out the same answers, and it isn't always that case. So it was a good reminder, and thank you for the reminder that not everybody does that same level of care. Forget about that.
Well, on that note, thank you for being you. If I was out there in the Fargo area and I had crunching going on, sounds in my jaw, you'd definitely be the person that I would come and see. So, you know, thank you, thank you
Yes,
again for that.
yes, thank you. Appreciate you.